All right. And with that, we'll go ahead and get started. So thank you everyone for joining us today for a summer sampler lunch and learn brought to you in part by South Sound Business Magazine. We are very excited to bring these free sessions to you this summer and give you a little preview of our classes and our excellent instructors. So my name is Sarah Lynn Smith. I use she, her pronouns, and I am a program development manager here in the UW Tacoma Professional Development Center. If you're not familiar with us, the PDC, as we're called, and you may hear about us that way, is a self-supporting unit specifically focused on delivering non-degree professional development programs. And those range from short webinars and lunch and learns like this to full certificates and customized training. And as an institution in Tacoma, I also want to acknowledge that we are on the ancestral homelands of the Coast Salish people, specifically the Puyallup up here in our area. Today, I'm excited to introduce to you Cary Randow. He is an instructor in our certificate in human resources management and a lovely person. The session will run approximately an hour, possibly a little less depending on how things go. And I'll turn it over to Cary here after just a couple of housekeeping items. So as I mentioned a number of times, your mics are turned off by default. However, the chat is open for questions and comments. And Cary has said that he would love for you to post clarification questions if you have them as we go on. Otherwise, we will do Q&A at the end of the session. We have also turned on what's called auto transcript in Zoom, kind of like closed captioning. If that has popped up for you on the bottom and you find it distracting, you can click on that little closed caption icon on your Zoom toolbar and select hide subtitle. It'll go away, but just for you, and then the folks who need it can use it. So with that, I am going to go ahead and turn it over to Cary, who can finish introducing himself. Introducting is not a word.
Hello. Well, I wish to welcome you as well. As Sarah Lynn said, I'm Cary Randow. I'm an instructor with the University of Washington Tacoma's Human Resources program. I teach compensation, 2 courses, compensation and the benefits course. Today, we're all about benefits. And this is an area of growing importance. I don't think a day passes where we don't see something related to everything from issues related to healthcare in general, the pandemic, Medicare, Medicaid. It seems to be like it's everywhere. And so I am really pleased to bring this presentation to you, and really hope that after the end of it, you'll have a better understanding of what we're really trying to provide here. Is really an understanding, an explanation of healthcare. And I think this presentation works for both patients like yourself, employers could be as well, policymakers, designers, everybody I think can take away something from this presentation. I've been in benefits, managing benefits for nearly 35 years. And I've learned a couple things. One is when you speak of benefits, you really need to kind of keep it simple because people just don't spend very much time thinking about benefits until they need them. And then they really need them, or they're really thinking about them. So the key here is to try and present something in kind of a model format. I love pictures. I've learned a lot from pictures. And so that's what I've done here is I've developed a model about 15, 16 years ago. It's simple, it's a triangle, and it helps me sort of through a process of explaining the key factors in what influences healthcare costs, your experience, and so forth. So I want to be sure that as we go, if you, again, as Sarah Lynn said, if you have any clarification questions, please bring them up. If not, then we'll take questions at the end. The benefits triad, as I call it, sort of started out as a teaching tool. And I said about 15, 16 years ago, I developed this tool to help explain some of the key factors in employee benefits. Things that, terms that you may be familiar with: access, utilization, quality, also, the various aspects of your benefits plan design, which would be deductibles, copays, stop losses, all of those sorts of things. So it can be as technical as we make it, but I'm trying to present this today so that you will come away with a knowledge sort of based on your level of experience and interest. So the Triad is, so I've explained, is a simple model of thoughts and concepts. And so we work back and forth on that to allow both policy analysts and decision leaders to understand the components, and importantly, the interconnectivity of healthcare delivery and costs. As I indicated, this model works for patients like yourself, or employers perhaps you're managing or influenced by benefit plans with your employer, and then of course policy analysts and decision leaders. And I've presented this to all of those folks, and have come away with at least an understanding of how they view this model. And I'll try and share that as we work through it. These are the key factors. Excuse me. Trying to get my screen here. Let's see. So these are the three factors at the very bottom. I hope you can see that is access, and that is the gateway to this model. Everything in healthcare begins with access, and we'll talk about that specifically in a few minutes. But it's key, and that's why it's at the bottom. If you don't have focus on access, everything else will not work. Utilization is an issue, becomes a problem. Certainly, then quality is an issue as well. So we will focus quite a bit on access and how it's achieved, how it's denied, and how important it is to this model and this discussion. So access is the ability for an individual to obtain the benefit in a reasonable and timely manner. There are many things. I think we're up to 30 now factors. I've just listed a few, and I'll talk about a few more that actually influence access, and things that you might not even understand how they might affect this important component. These are no particular order of importance, but transportation is, particularly in the inner city, where people don't have ready transportation, or they could live in very rural areas and find it difficult to actually get in, even though they may have healthcare insurance, to actually get into a doctor's office. Or as we're finding out today, sometimes you'll make an appointment and it's the doctor saying, well, we're booked for 3 weeks or 3 months. And so, it's not just the location, proximity, transportation, but it could be the availability of the doctor, the surgeon, whoever you're trying to access. Another issue is healthcare status. Some people wait till the last minute to try and access the system, and then are disappointed when you receive the word back from the doctor's office that we just can't fit you in until this time or that time, and so forth. And so I think we probably all have experienced that as well. There are a number of other access issues that I think are important to talk about as well. One of those, and the most important, is does the individual have health insurance? And many people, particularly in areas of high poverty, in areas combining high poverty with rural locations, just don't have insurance. There are no large employers in the area, or even middle-sized employers that might have healthcare plans that you can access for basic care. And so many people will go without care, or their children may go if they may have it, but their children might not after they're out of the house. So the whole issue of how do we deliver healthcare to the greatest number of individuals who need it is always something that healthcare designers and people are trying to focus on. And you as an individual accessing healthcare, many people will make decisions, particularly in retirement, to go to places where they know there's going to be a robust healthcare system made up of a number of different healthcare provider types, specialists, general practitioners, those that have a lot of experience in senior care and things like that. So access is a key part of getting started on the road to achieving a good healthcare plan and for achieving a good outcome for you yourself. The key, I think, here too, is we talk about these three factors: access, utilization, and quality. Is they're not just three factors. These three factors are key in terms of how healthcare is delivered and utilized. And so I think here the interconnectivity is an important point to really emphasize, is that you can grant ready access and still have poor utilization and poor quality outcomes. And what we're really trying to say is that a system in balance that looks at access in the way that it should be conducted, utilization in terms of how individual plans are developed and the kinds of services that you will see from a doctor. And then quality, which is really a hard factor to measure. An individual may know it when they see it or feel it, but often when you're trying to assess quality on a larger basis, it's hard to determine whether the quality is a short-term quality outcome or a longer-term quality outcome. And so you really got to stay focused on all three of these factors when you're making design decisions and you're assessing your own healthcare experience. In the Seattle Times, interesting, in the Seattle Times today, there was an article. The Oncology Society was having a meeting and presenting a presentation regarding the efficacy of after surgery care for cancer patients was being discussed. There was an article written in the New England Journal of Medicine that in many cases, chemotherapy and other sort of utilization services from cancer are really not needed and are not really contributing to quality. They did a long-term study and sort of focused on post-surgery utilization of chemotherapy and other factors, and didn't find in many cancers that there was a strong correlation between chemotherapy and higher quality outcomes, which is real interesting. So just to kind of explain how healthcare providers, researchers, and so forth will look at this. Obviously, if you're not having to undergo chemotherapy, which can be very debilitating for people, you're skipping that part of the service. You're obviously going to be skipping some of the cost, which could be good, but also skipping the whole thing about people having to go through chemotherapy and the debilitating part and issues that arise from it, while still achieving the quality outcome that you have the surgery for and from the very beginning. So that's just an example of how you can look at any sort of factor related to healthcare and try and understand it better using this model. Utilization is the actual or scheduled number, type, duration of procedures received by the individual. A number of things will influence utilization. Different services cost different things. Type and duration of procedures. Some doctors, particularly general practitioners, require, before you see them, if it's been more than 6 months to a year, require that you have a series of labs. and that they get lab results so that they can measure, all different kinds of things that the labs are intended to cover. Whether that is a procedure or process that is necessary, really sort of focuses on the individual themselves and what they're in for with the doctor. But that is a form of utilization that is often criticized, where people saying, I don't need this, I don't need that, I just had a laboratory result 6 months ago, nothing's changed, and so on and so forth. So those are some of the things that, in terms of utilization, might be questioned by individuals themselves. Doctors obviously, want to have as much information as they can when they're consulting with their patients, and so they often do require labs or ask you to have a lab before they follow up with you. Type of health problem is another area of utilization. If you're dealing with very serious ailments, certainly cancers, other forms of strokes and heart disease and things like that, your utilization is likely to be higher. And part of utilization are prescription drugs. They're included in that, and so you may be running up a large cost bill or cost utilization factor by virtue of a higher level of health problem. And the question is, do I have, what is the health outcome, or what is the quality of all of these services that I'm providing? And is that questioned? Sometimes doctors fall into a routine on certain medical problems, issues, things like that, and they'll go with a set prescription of services, while others sort of have their own issue and their own approach to dealing with utilization on key diseases and health problems. It's the area where you have very high utilization, lots of services, labs, things like that, but the health problem doesn't appear to be very significant. They could have sore throats or hearing problems or any kinds of things like that, maybe just everything from just a cold to something that's a bit more problematic, but not necessarily a real serious health problem. And so you got to focus on how much utilization is occurring with my doctor, with my healthcare provider, when I actually get the access to go in and address this issue that I have. And location and type of medical facility is also part of the utilization. Again, if you're in a rural area, if you're not in a rural area, you're in an area, an urban area, healthcare costs tend to be more expensive in general. One of the reasons is that there's a lot of competition, and because people have healthcare insurance, doctors will typically try and charge as much as they can for the type of service that they're providing to you from a medical basis. Some hospitals are just more expensive. Those that are deal with a lot of Medicare issues and not getting as much reimbursement for services will typically charge people that have health insurance more money. And so location and type of your medical care could drive utilization costs as well. You may be in a specialized facility like a cancer care clinic, and you're guaranteed to have more expenses, higher expenses there, as most of your medical providers are specialists, and the specialists will tend to cost more, charge more for their services than a general practitioner. But of course, they're dealing with a specific medical problem that you're experiencing. So these sorts of things are all contributing to utilization. And this is an area where people just really get confused a lot because they go in and they've got the access, they have the issue that's bothering them, and the doctor is taking charge and making referrals and performing services and so on and so forth, and the patient is just sort of taking it in. Like, well, okay, if the doctor says that's what's needed, that's what I'll go with. But you have to, in terms of good healthcare consumer, question some of the things, and so that the doctor knows that this is a patient that really wants to know why certain things are being prescribed, why certain services are being requested or referred to. And so this is an area that where you can capture a lot of cost, higher cost or lower cost, depending on what the issue is, and is very focused on quality. If you've got too much utilization, often quality will suffer because you're thinking, well, I've got this done, that done, and so forth, and everything is fine, when in fact, no, it's not. And on the other side of the coin, you've got issues with respect to some plans will only look at a certain part of the condition that you're in and ask you to follow up with another appointment. Sometimes that works, sometimes it doesn't. So utilization can determine a lot of the cost of healthcare, but can also have a lot of influence over the quality that you're going to experience in these facilities. Then quality is the actual or intended use, outcome of all procedures completed, and they're designed to improve the health of the individual. You'll see sometimes healthcare plans will target or make specific healthcare institutions available for certain kinds of very highly serious cancers and other healthcare issues, including heart procedures, heart surgeries, things like that. And they will require or make available these facilities to plan participants, even though they're going to be more costly initially. The healthcare companies believe that the utilization process that these different hospitals and healthcare providers utilize provides a much more assured, high quality outcome. And that's where you really can influence the quality, is by making sure that the facilities that are available, particularly those with very serious illnesses, can be called upon in a healthcare plan and utilized. Even if you may have to go to Seattle, you live in Tacoma, you live in Olympia where I live, but an outcome maybe of higher value if you're going to the cancer care clinic in Seattle versus a hospital generally where you're dealing with local oncologists. There may be a much more consistent, higher quality outcome if you go elsewhere where doctors are sort of specifically focused on this particular issue, and the hospital supports it a great deal. You'll find this quite a bit too in where you've got medical problems dealing with back surgeries, any kind of surgery dealing with the spine, heart surgeries, other sorts of things where the hospital may have very strong ability to do it, but you've got these other hospitals that really just focus on that particular area and create quality outcomes that are measured both in terms of the situational quality, which is sort of the short-term quality part, and then the long-term outcome as well. So looking at what was the outcome early after the surgery or after the service that was provided, but after 2 or 3 years, do we still, is that quality held up, or is it sort of gone back to a general outcome that any hospital could achieve? And the mortality outcome. So how long, particularly in very serious areas, illnesses, has the individual lived, and what's been their quality of living, I guess is the best way to describe it, since the surgery. You could have put the cancer in remission, but also created a very difficult issue of pain for the individual. And all of a sudden, they've got another problem, which is perhaps drug related. And so you really, what you've sort of taken one issue of quality and substituted it for another. So these are the factors, three factors that I think are apparent in any sort of healthcare issue. If you look at, people ask me all the time about what's the difference between the Canadian healthcare system and the US healthcare system. And I'd say, well, access for one. In the socialized medicine, which most of the European countries practice, as well as Canada, access is guaranteed, it's free, and utilization is sort of measured as this is the way we utilize and this is the way we treat this specific procedure. But also, we suffer a great deal in this country from lack of good documentation. And I would think that that both utilization and quality could be achieved even without socialized medicine if we had a nationwide system of medical documentation that made it easier for doctors to access patients' medical histories and things like that. A lot of people are concerned that something like that could be broken into, hacked, and their individual medical situation made apparent to others. But I think that's a small issue when you look at the benefits of that approach. People talk about Medicare. Medicare is socialized medicine. You will get access, utilization, and hopefully quality measured by policies and procedures related to Medicare treatments. And so you have pretty much an open access model for Medicare. And then Medicare has allowed coverage of a number of different things that many healthcare, individual private healthcare plans don't. This drug that deals with Alzheimer's, I can't remember the name, was something that was denied by healthcare plans across the board. And finally, Medicare stepped up to actually provide it. And it's a very expensive drug. And so it's driven up utilization. But it's one of those where it's been a policy issue related to the growing issue of Alzheimer's, and the US federal government decided that they felt it was important enough to have this drug available. But it is very expensive. And so these are just areas of healthcare that you may have already been experiencing, like myself, excuse me, or you may know of others or your parents, and they have questions and so forth. I think what I really wanted to try and get out of this discussion presentation is an improved understanding of these factors. And if you're a policymaker or employer that's trying to explain their healthcare plan, that you're using these factors to explain how the process works, because it really, all medical procedures and processes go through the access, utilization, and quality model. And I think the key again is that we're achieving balance in this. Now, balance is over the longer term. It may be imbalanced short term in order to affect a higher quality outcome, like the discussion we just had about higher level medical facilities, higher cost medical facilities. So your utilization may be higher in short term, but once the higher quality is achieved, that brings the system back into balance, because you're not treating that medical problem as much, or the severity of it as much. And so you will experience lower costs as a result of that. That's why cost is sort of in the middle of this model, is that everybody focuses on cost because it drives design. It drives all these factors and how much access is going to be allowed and under what conditions, what type of utilization is procedural, what has to maybe get second or even third opinions for, and then how is quality measured. And I think if you're an employer, I've always asked people that I'm consulting with that are assessing healthcare plans, ask them how they measure or assess quality. Because once sort of the rubber hits the road and you've had this utilization, you expect a certain high quality outcome. That's kind of what we are about in our medical system here in this country. And if it's not achieved, then what has not occurred? Is it an issue that your access was denied for too long, or that utilization was cut back, or utilization was improper for the issue, the medical issue that was being addressed? So quality is really important, and I think you know it when you see it. But designers and healthcare employers will focus on that because it drives a lot of decisions about program design and where they go. Because if you don't have high quality outcomes, then you have a real problem with your healthcare plan, and it's just going to be more costly and less effective. And those are plans that don't get a lot of support. So in closing, I want to just, again, key here is understanding is key to developing and managing your healthcare benefit. And that includes you as a patient in managing your own healthcare. And when is it important to go see a doctor? When is it not? Some people will go in at anything that they feel is not going well for them in their healthcare. They'll go see a specialist as opposed to maybe their general practitioner. Some people will wait way too long to access their healthcare system while issues and problems have been developing. And so it's understanding when it's time, when it's appropriate to access and then utilize your healthcare benefit. That I think individual patients need to focus more on, and employers need to help employees understand when and how to do that to keep their healthcare costs down. And I've used this model with a number of small, medium-sized employers that are trying to get their healthcare costs under control, and briefing employees and their healthcare providers on how to manage their healthcare plans through better access, utilization, and achieving the higher quality outcomes. So I've run through that pretty quick, I think. But the more you think about this model, sort of letting it soak in, the more you understand it, and that you can pick up a newspaper and evaluate things that are going on, say healthcare changes in general. The pandemic has created a lot of issues with respect to utilization. One of those is just overwhelming the system with respect to access. COVID-19 is a very serious illness and can be, as we know, it can create death in very quick order. And so the federal government has stepped up and required healthcare providers to provide the treatments for COVID-19 free. So that's put a lot of difficulty with respect to cost onto healthcare providers and employers in general. And so where is that going? Getting vaccines is part of utilization. And that's where we really had issues with respect to the pandemic, is that we had a lot of people who felt like they didn't want to take the shot. They didn't want to do anything to address the potential for catching COVID-19. So we had a lot of issues and early deaths and avoidable deaths as a result, which is obviously a poor quality outcome. So the key here is understanding this model. How would you have developed or how would you have approached providing healthcare to millions and millions of people in this country, and still achieving a balance in access, utilization, and quality? And normally in my healthcare classes, we spend at least a couple classes talking about the pandemic and this model, because I think pandemics in general, epidemics in general are going to be with us. That's just my personal view, but I can see that a lot of healthcare providers and experts view healthcare in a different light with respect to how they're going to approach the access, utilization, and quality of COVID-19 related type of illnesses. We're still trying to figure out, in terms of the quality, what they call long stage people with COVID-19, those that still have ongoing symptoms, as they're not nearly as demanding or as difficult to deal with as the initial COVID-19 outbreak, but these long-termers are experiencing issues, all kinds of healthcare issues, and they're trying to determine was access or utilization involved, or a misunderstanding of quality in terms of how we have these long-term issues with COVID-19, because many don't experience them at all. And so those are ways that people are using this model, particularly healthcare designers and federal officials. I've briefed them several times on this model and had good discussions with them related to how they intend to address the next pandemic. Hopefully it won't be nearly as bad as the COVID-19 Delta variation, but Omicron and is going to be replaced by something else, and it's proven to be not as lethal, but every bit as contagious, or more so than the original COVID-19 benefit. So with that, I will turn things back to Sarah Lynn, or your questions.
Yeah, let's, I am putting that in the chat right now. So if you do have questions for Cary about this model or about benefits in general, please feel free. I can turn the mics back on too if we feel that's more conducive. But I do want to start off and ask you a question, Cary. So spoiler alert, everyone, actually asked Cary specifically to talk about this topic for his for his webinar this summer, because it's a model that I'm not a benefits professional, but it's something I think about a lot, right? Not just when it comes to myself as a consumer, but in a variety of different things that I do professionally and personally, right? That quality, access, and utilization. So you talked a lot today about healthcare, but you can apply that also to other types of benefits, right? So like financial benefits or educational benefits, is that right?
Absolutely, you can. You can apply it even to non-healthcare as well, because the ability to obtain the benefit or whatever you're trying to achieve is access.
Right.
And so when you look at even investments, getting access to certain investments, like it's real easy to get into a mutual plan with an investment counselor, but very difficult and expensive to buy Amazon stock or Tesla stock. And so the high prices that these stocks have achieved deny access to a lot of people that just can't afford to, $4,000 or $5,000 a share or more. In that case, and utilization in that sense would be what do you have available that you can invest in. And you're in a mutual fund. There are hundreds of mutual funds, thousands actually, and what do they invest in, and what can you what mutual fund can you be a part of, or what mutual funds can you be a part of? And then quality obviously is, how is the stock doing? How's the company doing that you're investing in? How do you view short-term downturns like we're having now? The market goes up and down and this and that, but over time, investing in the stock market has been one of the highest quality outcomes for financial gain of any method. Art is interestingly the top, and real estate is close behind it. but long-term consistent investing is a strong third in terms of quality. So you can use this model for a variety of different subjects.
Yeah. And I think a lot in my setting as a professional development person, right, who's going out and talking to companies or different folks about things like education benefits for their employees, right? So I think it's very interesting when companies start talking about offering educational benefits, and they'll talk about things, there's pros and cons to most of them, right? And so something like LinkedIn Learning, which a lot of organizations have purchased subscriptions to, is an incredible access, right? It does gangbusters on access, right? You can give it to everybody in your company. It's pretty cost effective. You may even have decent utilization, right? In terms of, how many people are actually watching the video, create an account and are, accessing. But when you, as an HR professional or whoever in the organization, go to look at, well, how's it doing on that third tier, right, of quality? That definition, how are you defining quality, becomes really important, right? Is it based on your outcome? Are you seeing, differences on employee evaluations, or is it more about, are people actually finishing the classes that they start, right? They may be using it, but are they doing a certificate or whatever?
Are you dealing short or long-term outcome?
Exactly. And so I think for me, that's it's another really good example of that triangle, because you have to be really conscious that just because you're saying, hey, this is something everybody can do, that doesn't mean it's going to get you where you want to go with that benefit, achieve the goal of that benefit.
Yeah, I think a big mistake that a lot of employers make is that they focus on access, but really sort of don't pay a lot of attention to utilization. People want the benefit. Okay, we're going to provide the benefit. Well, how have we designed it so that we balance it? We balance the cost, we balance the services that are provided when you do access the system, because the bottom line is quality. It's always about quality, whether it's a quality healthcare outcome, whether it's a quality financial outcome, whether it's a quality educational outcome. Just giving access is not enough.
Right, because then if you have something that's quality, but no one's using it, then what's the point?
Right. Exactly.
Yeah. I'm going to go ahead and launch a little feedback poll in case people need to take off.
I've got one chat.
Oh, that's just me telling people. So I will, let's see. So if I'll go ahead and let people turn their microphones on if they want. Maybe folks will be a little more. Here we go. So if anyone has any questions for Cary, please, you can turn your microphone on if you'd like. I will say, if you put your video on and you speak with your microphone, that will come up in our recording. But otherwise, you're welcome to use the chat. We do have a few minutes here for questions.
Okay.
So we'll just sit here in silence for a minute. It'll make everyone very uncomfortable. See if anyone has any questions. Yes, Jerry, good question on a logistics angle. Yes, we will be posting, it will either be Thursday or Friday, because it takes us a minute to pull it down, make sure it's all cleaned up and get it uploaded. But we will send out a link to the video recording via email on either Thursday or Friday. Yes. And definitely please feel free to share it with others. Denise, thank you for letting me know. But yeah, please feel free to share it with others. Cary does, as he mentioned, he teaches in our HR certificate program. So he teaches our compensation rewards and performance management course, as well as our employee benefits course. But he also, as he mentioned, does consulting and that sort of thing. So if you think a conversation, someone facilitating a conversation like this with your organization or in a professional association you're a part of would be useful, please let us know. We are also starting this year a couple of partnerships with a couple of local to us in Tacoma SHRM chapters. So you may see Cary or I or other HR instructors at the South Puget Sound SHRM meetings or the Lake Washington HR Association SHRM meetings. But if you're looking for, guest speakers or consultants or anything like that, in addition to what we offer through the center, please let me know.
And my email is available, right, to participants?
Yeah, if you would here, I will, I'm going to put my email address in the chat, and you can let me know if you have questions either for myself about our programs or for Cary. With that, I'm going to say thank you, so I can stop the recording here, and then we can continue chit-chatting if we want to. But thank you so much, Cary, for this, agreeing to present on this specific topic per my request, and to everyone for coming today. We do have, I think, still 14 summer sampler sessions coming up. There is one tomorrow on integrating an equity lens into project management. It's an introduction to one of our longer sessions. And then we have some other HR topics coming up about employee engagement and various other topics. We have some nonprofit management. We have a variety of DEI ones. So I definitely encourage you to join us for those if you have not RSVP'd for any of those other ones. Again, thank you so much for coming, and we hope you have a great day.